1. Which principle of adult learning suggests that learners are most motivated when content is relevant to their personal and professional goals? A. Passive observation. B. Intrinsic satisfaction. C. Self-directed learning. D. External validation. 2. What evaluation method best measures the effectiveness of hands-on clinical skill training in LPN education? A. Peer review. B. Oral quizzes. C. Performance-based assessment. D. End-of-semester surveys. 3. In curriculum development, which component ensures alignment between learning objectives and instructional strategies? A. Clinical affiliation agreements. B. Curriculum mapping. C. Student feedback surveys. D. Program brochures. 4. Effective communication in clinical instruction includes A. Speaking quickly to maintain flow. B. Avoiding questions during demonstrations. C. Using closed-ended questions. D. Providing timely, clear, and concise feedback. 5. Which federal regulation outlines standards for nursing aid training programs? A. HIPAA. B. OSHA. C. OBRA. D. EMTALA. 6. A mentoring strategy that enhances skill retention in new LPNs is A. Prescriptive lecturing. B. Rote memorization. C. Shadowing experienced nurses. D. Simulation-only learning. 7. Which of the following best illustrates formative assessment in clinical education? A. Licensing examination. B. Mid-rotation skill check. C. Course final exam. D. Graduation competency review. 8. What is a key adult learning theory that emphasizes learning through reflection on experience? A. Skinner's behaviorism. B. Kolb's experiential learning. C. Pavlov's conditioning theory. D. Maslow's hierarchy. 9. When designing a new LPN course, the first step is to A. Choose textbooks. B. Identify evaluation tools. C. Define course objectives. D. Hire instructors. 10. What method best promotes critical thinking in LPN clinical settings? A. Role modeling. B. Lecture-based instruction. C. Multiple choice testing. D. Silent observation. 11. Which action best demonstrates compliance with HIPAA in clinical teaching? A. Discussing patient cases in the break room. B. Using initials on student worksheets. C. Sharing case studies on social media. D. Posting patient photos in the classroom. 12. Which mentoring practice fosters autonomy in novice LPNs? A. Telling them each step to complete. B. Assigning them only observation tasks. C. Encouraging independent decision-making. D. Correcting every minor error. 13. Which of the following instructional methods most supports kinesthetic learners? A. Assigned readings. B. Group discussions. C. Demonstration with practice. D. Audio lectures. 14. What is the purpose of using rubrics in clinical skill evaluation? A. To grade students faster. B. To provide a subjective judgment. C. To standardize feedback and expectations. D. To rank students numerically. 15. A key principle of mentoring in LPN training involves A. Assuming all students learn the same way. B. Creating dependency on instructors. C. Encouraging reflective practice. D. Limiting peer interaction. 16. Which curriculum development process includes identifying stakeholders and their input? A. Curriculum evaluation. B. Needs assessment. C. Outcome measurement. D. Post-course review. 17. What communication strategy helps LPN students clarify complex procedures? A. Using medical jargon. B. Encouraging questions. C. Speaking in general terms. D. Limiting verbal explanation. 18. The most effective evaluation tool for assessing clinical judgment is A. True-false quizzes. B. Case scenario analysis. C. Attendance tracking. D. Pre-tests. 19. When teaching adults, it's important to A. Use abstract theory as the base. B. Control every aspect of learning. C. Relate content to prior experiences. D. Avoid practical examples. 20. A measurable course objective should include A. General ideas. B. Student preferences. C. Observable behaviors. D. Educator opinions. 21. Which is an appropriate mentoring behavior? A. Micromanaging tasks. B. Allowing unsafe practices to continue. C. Modeling best practices and professionalism. D. Withholding constructive criticism. 22. Effective feedback in clinical education should be A. Delayed until end of course. B. Judgmental and general. C. Specific, timely, and actionable. D. Provided only during evaluations. 23. Which adult learning model emphasizes social and environmental influences? A. Andragogy. B. Constructivism. C. Social learning theory. D. Behaviorism. 24. In evaluation, reliability refers to A. Subjectivity of scoring. B. Accuracy of student opinion. C. Consistency across measures. D. Number of students passing. 25. Communication barriers in clinical education may include A. Open body language. B. Frequent summarization. C. Language differences. D. Student paraphrasing. 26. A compliance-related concern during bedside teaching involves A. Student hesitancy. B. Patient confidentiality. C. Skill accuracy. D. Use of open-ended questions. 27. A course objective that states understand vital signs is A. Specific and measurable. B. Ambiguous and passive. C. Aligned with outcomes. D. Validated by curriculum mapping. 28. A technique to promote critical reflection in learners includes A. Peer grading. B. Memorization exercises. C. Clinical journaling. D. Group memorization. 29. Mentorship programs should focus on A. Enforcing dependence. B. Promoting long-term knowledge transfer. C. Discouraging innovation. D. Emphasizing testing over practice. 30. One challenge in evaluating clinical competence objectively is A. Overuse of multiple choice tests. B. Student engagement. C. Subjective assessor bias. D. High cost of textbooks. 31. Which of the following best defines constructive feedback in a clinical setting? A. Feedback that is vague but positive. B. Feedback given only during final evaluations. C. Specific feedback that focuses on behavior and improvement. D. Negative feedback that emphasizes consequences. 32. Adult learners in LPN programs are more likely to engage when A. They are lectured continuously. B. The content is passive and abstract. C. The learning is self-paced and relevant. D. They are not held accountable. 33. What type of evaluation best captures the learner's ability to apply theory to practice? A. Online quizzes. B. Practical simulations. C. Multiple choice tests. D. Course surveys. 34. A well-developed curriculum is structured to A. Meet instructor convenience. B. Follow textbook chapters. C. Align learning objectives with outcomes. D. Reduce assessment frequency. 35. When mentoring a struggling student, the LPN educator should A. Ignore the issue. B. Remove them from clinicals immediately. C. Identify barriers and offer guidance. D. Increase test frequency. 36. What does summative evaluation primarily measure? A. Progress during instruction. B. Clinical judgment improvement. C. End-of-course competency. D. Student stress levels. 37. How can instructors ensure alignment in the LPN curriculum? A. Use arbitrary grading. B. Rely only on textbook quizzes. C. Map objectives to instructional activities and outcomes. D. Decrease skill practice. 38. Which statement reflects a regulatory priority in LPN training? A. Patient safety must always be prioritized. B. Instructors may override protocols. C. HIPAA only applies after graduation. D. OSHA rules are optional for students. 39. Which mentoring strategy builds trust with adult learners? A. Critiquing performance in public. B. Demonstrating respect and confidentiality. C. Assuming disinterest in feedback. D. Overloading with tasks. 40. An example of ineffective communication in clinical instruction is A. Encouraging open discussion. B. Giving specific praise. C. Using complex jargon unnecessarily. D. Providing clear instructions. 41. The primary purpose of a learning objective is to A. Entertain the students. B. Promote instructor flexibility. C. Clarify expected outcomes. D. Reduce evaluation time. 42. Which of the following promotes learner-centered teaching? A. Reading aloud from a textbook. B. Limiting discussion. C. Involving learners in problem-solving activities. D. Focusing on instructor lectures. 43. A common barrier to effective mentoring is A. Scheduled meetings. B. Consistent feedback. C. Lack of role clarity. D. Use of reflective practice. 44. In clinical skills evaluation, validity refers to A. How subjective the assessment is. B. Whether the test measures what it claims to. C. The number of students passing. D. The ease of scoring. 45. Adult learners benefit from feedback that A. Focuses on unrelated tasks. B. Is punitive. C. Promotes growth and insight. D. Is delayed until the final evaluation. 46. Which is the best example of an outcome-based objective? A. Understand wound care. B. Know hand hygiene. C. Demonstrate proper catheter insertion. D. Think about patient comfort. 47. Which law requires LPN programs to include instruction on resident rights? A. Title IX. B. ADA. C. OBRA. D. OSHA. 48. Which mentoring behavior undermines student confidence? A. Celebrating successes. B. Giving balanced feedback. C. Constant micromanaging. D. Encouraging autonomy. 49. Peer feedback can be an effective tool when A. Peers lack clinical experience. B. It is structured and guided. C. There are no rubrics. D. Feedback is anonymous and unmonitored. 50. In adult education, scaffolding refers to A. Testing at frequent intervals. B. Providing layers of support that are gradually removed. C. Building curriculum based on age. D. Assigning excessive readings. 51. Which technique supports reflective learning in clinical settings? A. Case study discussions. B. Silent demonstrations. C. Closed-ended tests. D. Limiting student questions. 52. What is the first step in developing a clinical skills checklist? A. Choose test format. B. Identify critical tasks and standards. C. Create scoring rubrics. D. Assign instructors. 53. To ensure ADA compliance in the classroom, an LPN educator must A. Assign tasks equally regardless of ability. B. Allow no accommodations. C. Provide reasonable adjustments for learners with disabilities. D. Lower academic standards. 54. When delivering critical feedback, the LPN educator should A. Delay it until course completion. B. Deliver it publicly. C. Use the sandwich method. D. Provide sarcastic comments. 55. Which assessment method provides real-time data on student performance? A. Post-course evaluations. B. Standardized tests. C. Clinical observation. D. Curriculum mapping. 56. In mentoring, modeling refers to A. Testing students under pressure. B. Demonstrating desired behaviors or skills. C. Asking students to guess answers. D. Giving vague directions. 57. What is the best way to encourage accountability in LPN students? A. Avoid performance expectations. B. Assign unclear tasks. C. Set specific, measurable goals. D. Remove clinical evaluations. 58. Which document provides formal evidence of curriculum alignment? A. Textbook index. B. Attendance record. C. Curriculum map. D. Faculty resume. 59. Which federal regulation protects patients' health information in teaching settings? A. EMTLA. B. FDA Act. C. HIPAA. D. NIH guidelines. 60. What action violates ethical teaching in clinical instruction? A. Encouraging independent thinking. B. Using students to perform tasks without supervision. C. Using simulations. D. Observing student progress. 61. Which principle of adult learning emphasizes relevance? A. Conditioning. B. Repetition. C. Practical application. D. Reinforcement. 62. Reflective journaling helps students to A. Memorize facts. B. Avoid difficult cases. C. Process and evaluate experiences. D. Skip practical training. 63. A common sign of poor curriculum design is A. Overlapping learning objectives. B. Integration of clinical practice. C. Use of multiple teaching methods. D. Alignment with national standards. 64. When evaluating student performance in for insertion, the most valid method is A. Written quiz. B. Peer grading. C. Direct observation with checklist. D. Attendance log. 65. Adult learners expect instructors to A. Dictate all learning methods. B. Control every learning opportunity. C. Treat them as partners in learning. D. Avoid discussion of goals. 66. A good mentoring goal includes A. Vague behavioral outcomes. B. Clear timelines and expectations. C. Undefined skill objectives. D. No follow-up evaluation. 67. Which learning style prefers visual tools and diagrams? A. Auditory. B. Kinesthetic. C. Visual. D. Verbal. 68. Which is a summative assessment? A. Practice quiz. B. Weekly journal. C. Midterm evaluation. D. Final practical exam. 69. What strategy promotes interprofessional collaboration in LPN students? A. Individual study plans. B. Isolation from other departments. C. Team-based clinical simulations. D. Instructor-only feedback. 70. Which of the following supports regulatory compliance in clinical training? A. Ignoring patient consent. B. Providing unsafe environments. C. Following OSHA and HIPAA standards. D. Allowing students to diagnose. 71. In adult learning, intrinsic motivation is often driven by A. External rewards. B. Mandatory tests. C. Desire for competence and autonomy. D. Peer pressure. 72. A clinical evaluation form should include A. Student height and weight. B. Measurable competencies. C. Personal anecdotes. D. Instructor hobbies. 73. When planning mentorship sessions, instructors should A. Ignore mentee goals. B. Create a flexible, supportive plan. C. Assign without input. D. Avoid goal setting. 74. What approach supports equity in nursing education? A. Providing standardized access to resources. B. Offering unequal workloads. C. Favoring some students. D. Skipping orientation. 75. A common ethical violation during clinical teaching is A. Asking permission from patients. B. Letting students fail on their own. C. Breaching confidentiality. D. Offering constructive feedback. 76. One effective way to teach time management is A. Giving no deadlines. B. Assigning long-term group projects. C. Practicing prioritization through scenarios. D. Limiting schedules. 77. The primary focus of formative evaluation is A. Ranking students. B. Supporting learning during instruction. C. Generating final grades. D. Enforcing discipline. 78. What method is most appropriate for evaluating a psychomotor skill? A. Multiple choice test. B. Essay writing. C. Skills demonstration. D. Peer review. 79. In clinical teaching, what enhances retention for adult learners? A. Passive lectures. B. Interactive, hands-on experience. C. Watching videos without discussion. D. Repetition without context. 80. What best reflects adult learners' preference for control? A. Instructor-led plans only. B. Autonomy in goal setting and learning activities. C. Daily mandatory quizzes. D. Avoiding learner input. 81. In clinical mentoring, setting SMART goals ensures that A. Goals are complex and unachievable. B. Student progress cannot be tracked. C. Objectives are specific, measurable, achievable, relevant, and time-bound. D. Mentors avoid accountability. 82. What type of learning environment best supports adult learners in clinical practice? A. Hierarchical and passive. B. Controlled and inflexible. C. Collaborative and respectful. D. Competitive and isolated. 83. A common pitfall in clinical evaluation is A. Using multiple evaluators. B. Including student self-assessment. C. Lacking clear performance criteria. D. Applying standardized checklists. 84. An effective clinical instructor models which of the following behaviors? A. Avoidance of student questions. B. Strict adherence to outdated methods. C. Evidence-based and ethical practice. D. Favoritism in student assignments. 85. Which instructional strategy enhances problem-solving among LPN students? A. Memorization drills. B. Instructor monologue. C. Case-based learning. D. Timed worksheets. 86. What should be considered when assigning students to clinical sites? A. Instructor convenience only. B. Students' ability to observe varied experiences. C. Number of exams in the semester. D. Distance from the main campus. 87. A peer mentoring program benefits novice LPN students by A. Increasing dependence. B. Decreasing accountability. C. Enhancing confidence and skill acquisition. D. Reducing student collaboration. 88. Which of the following promotes open communication between mentor and mentee? A. Scheduled time for private dialogue. B. Ignoring emotional cues. C. Speaking only through written feedback. D. Avoiding difficult conversations. 89. The purpose of using a standardized skills checklist in clinical training is to A. Provide subjective feedback. B. Ensure consistency and objectivity. C. Decrease instructor oversight. D. Increase administrative tasks. 90. When evaluating communication skills, the instructor should observe A. Test-taking ability. B. Frequency of attendance. C. Clarity, empathy, and listening. D. Textbook memorization. 91. Which of the following tools is best suited to evaluate student clinical decision-making? A. Skill lab check-off. B. Multiple choice exam. C. Clinical case scenario analysis. D. Attendance record. 92. To foster critical thinking, instructors should A. Encourage rote memorization. B. Penalize incorrect answers harshly. C. Ask open-ended questions and guide reflection. D. Limit student discussion. 93. Regulatory standards in nursing education aim to A. Reduce graduation rates. B. Standardize minimum competencies. C. Eliminate clinical training. D. Restrict interprofessional education. 94. What is the role of reflection in clinical learning? A. Encourages memorization. B. Promotes self-awareness and deeper understanding. C. Slows down the learning process. D. Minimizes error correction. 95. A lesson plan that includes simulation and debriefing is an example of A. Passive instruction. B. Theoretical orientation only. C. Experiential learning. D. Memorization strategy. 96. When students repeatedly fail a skill despite feedback, a mentor should A. Remove them from clinicals. B. Assign them written work only. C. Reassess teaching strategies and learning barriers. D. Delay intervention. 97. Which characteristic is least effective in a mentor? A. Approachability. B. Consistency. C. Judgmental attitude. D. Encouragement. 98. Which is an example of indirect evaluation? A. Licensing exam results. B. Clinical instructor ratings. C. Student self-reflection and course perception. D. Skills demonstration grading. 99. When evaluating skill performance, objectivity can be improved by A. Guessing student intent. B. Using anecdotal notes only. C. Implementing validated checklists. D. Providing verbal feedback only. 100. A critical part of mentoring in clinical practice is A. Isolation of learners. B. Minimizing independence. C. Supporting growth through structured feedback. D. Assigning repetitive work. 101. Which instructional approach combines theory and practical application? A. Self-study only. B. Lecture-based. C. Simulation with guided discussion. D. Textbook reading. 102. Which is the best reason for offering student-led demonstrations? A. Reduces instructor workload. B. Promotes active participation and confidence. C. Speeds up the class. D. Avoids instructor bias. 103. Instructors can promote accountability in students by A. Ignoring late submissions. B. Setting clear expectations and following up. C. Avoiding rubrics. D. Allowing self-grading. 104. The most ethical use of patient interactions in teaching involves A. Recording patients without consent. B. Excluding patient preferences. C. Gaining informed consent and protecting dignity. D. Sharing identifiable data for analysis. 105. Reflective questioning allows instructors to A. Replace tests entirely. B. Gauge factual recall. C. Encourage learners to think about their actions and reasoning. D. Test memory without context. LPN Nursing Care and Clinical Skills Test. The LPN Nursing Care and Clinical Skills Test is a specialized assessment designed to evaluate the practical knowledge, technical competence, and critical thinking abilities of licensed practical nurses (LPNs) in direct patient care settings. This exam covers essential areas such as vital signs monitoring, wound care, infection control, medication administration, documentation, and communication with patients and healthcare teams. It also assesses the LPN's ability to apply evidence-based practice, follow regulatory standards, and prioritize safety in clinical environments. Emphasizing hands-on proficiency and decision-making in real-world scenarios, the test ensures that LPNs are well prepared to deliver high-quality, ethical, and compliant care across diverse healthcare settings. Here are the top 5 beneficial uses of the sample exam. 1. Competency validation. The test confirms that LPNs possess the essential hands-on clinical skills and theoretical knowledge required to deliver safe, effective, and ethical patient care in real-world settings. 2. Regulatory and accreditation compliance. It supports healthcare facilities and educational programs in meeting state and federal regulations by ensuring that LPNs meet standardized clinical performance benchmarks. 3. Professional development. By identifying strengths and areas for improvement, the test guides LPNs toward targeted skill enhancement and continued learning to maintain professional competence. 4. Hiring and credentialing tool. Employers use the test results to make informed hiring decisions and ensure new staff can meet clinical demands from day one. 5. Curriculum evaluation. Educators use aggregate test data to assess and refine nursing curricula, ensuring instructional effectiveness and alignment with industry standards.